Hey there, residents. So we're on to another article here. Again, continuing on the kind of the pathway of menopause management, hormones, the questions around hormones, with cancer, bleeding, breast tenderness, all that good stuff. But this is a interesting article by Becky Glaser. And if you ever want to Google her, Rebecca, Glaser, done a lot of research with hormones specifically in the field of breast cancer. So this article right here, and again, just email me below and I'll send it to you. Incidence of invasive breast cancer in women treated with testosterone implants, a prospective 10-year cohort study. It was published in Biomed Central Cancer, and it was published in 2019. So I'll just kind of walk through some of the nuances with you as we usually do on this channel. So basically the background is it highlights that evidence supports that androgens are breast protective. So there's a lot of opinions, misconceptions, a lot of things out there with hormones and breast cancer. And this is looking at specifically testosterone pellets or implants. And it's also looking at testosterone pellets that are also combined with anastrozole, which, as you guys know, or you may not know, that anastrozole is an aromatase inhibitor, which prevents the conversion of that testosterone over to estradiol. So that's what they're looking at in the study. Again, it's a 10-year prospective cohort study, and it actually was approved in 2008 and then published in 2019. And it actually looks at 1,267 patients. And again, just like the WHI study, they're looking at incidence of 100,000. So in the results, they were looking at the testosterone group in 165 to 100,000, that ratio of incidence. And then in the placebo arm of the otherwise treated arm was 271 versus 100,000. So in the conclusion on the front page, it just says that long-term therapy with subcutaneous testosterone or testosterone combined with anastrozole did not increase the incidence of invasive breast cancer. And it says that testosterone should be further investigated for hormone therapy and breast cancer prevention. So those are kind of the big, if you only have 2 minutes and 50 seconds, you got the idea of the trial. But anyway, so let's do a little deeper dive here. Looking at the background, breast cancer remains the most common cancer in women worldwide, and preventive strategies are in their infancies. It also goes on to say that subcutaneous testosterone implants have been used to treat symptoms of hormone androgen deficiency in women since 1937, so the therapy's been around for a while. It also looks at testosterone is anti-proliferative in the breast and inhibits the stimulatory actions of estrogens. So there's a lot to unpack just in that statement right there, that if we ever meet, we can do that. It also says that there's been some concern about testosterone therapy in women. Obviously, everything here is controversial. And she notes that there's some epidemiological studies reporting an association, and she also says that it's not causation. So association and causation, totally different when you look at these things from an academia perspective. And she's also looking at, it's not causation between endogenous testosterone levels and breast cancer risk. So that was the point of that statement. So she also goes on to say that testosterone, biosimilar, non-methylated, bioidentical therapy in women has not been shown to increase the risk of breast cancer, and actually may lower the risk from estrogen-progestin therapy. Notice I said progestin, not progesterone, because that's a big difference. And if you want to do a deeper dive in that, go back to the video, probably 2 or 3 up, and look at the WHI study. Or again, when we meet, we can do a deeper dive in that as well, because that's important. So this is important. There is concern that testosterone aromatizes to estradiol, which has a secondary stimulatory effect via the estrogen receptor. Patients with increased aromatase activity may produce excess estrogen, resulting in breast tissue proliferation. Anastrozole, combined with testosterone in a pellet implant, has been shown to prevent aromatization and provide adequate levels of testosterone without elevating estradiol levels or increasing recurrence in breast cancer survivors. Testosterone also has been shown to safely relieve side effects of aromatase inhibitory therapy in breast cancer survivors. So again, all that's on page 2 of the, I'm just reading this to you. Good stuff there. So a interesting statement from the method side of the trial is that no patient was excluded. There was not participation. It doesn't, regardless of age, family history, prior hormone use, oral contraceptive use, endometrial pathology, breast density, increased breast cancer risk, menopausal status, or BMI. Breast cancer genetic testing was not part of the protocol as well. And moving on here, we mentioned the ages of the patients and their menopause status, which is important. 76.8% of the patients were postmenopausal, 23% were peri or premenopausal, and the mean age of the study was 52 years old. So that's important on the ages of the patients. And if you look at the actual breast cancer incidence, again, this is kind of a review from the first minute of the video, but in the testosterone therapy arm, 165 to 100,000, the ratio, and then in the control group, 390,000 to 100,000, so pretty significant difference there. And also goes on to say that there's results confirmed a marked reduction in the incidence/distribution of invasive breast cancer at 10 years in the testosterone and the testosterone with anastrozole group. In the discussion, they mentioned that it is a 10-year analysis. They actually go back to, and we're gonna cover this eventually, the Dayton study is another great study, and they actually refer to some statements from that study. Again, we're going to cover that study, so I'm going to skip over that because it really wouldn't make much sense to you right now. It also talks about the demographic characteristics, because our sample are those of normal population, which we just talked about, and they're not really specifically looking at women of low risk of breast cancer, nor specifically at high risk of breast cancer. Again, it's just a kind of across-the-board patient sampling. So in the conclusion section, it says that our 10-year results demonstrated a 39% reduction in the incidence of invasive breast cancer in our population compared to the SEER. We talked about that in the Women's Health Initiative expected incidence. Testosterone implants should be further investigated for hormone therapy as well as breast cancer prevention. So I think that was the big, so that's the results. And then she concludes with 38 reference articles. So again, great article. Email me in the link. Let me know your comments. Also, just like anything that's on here, if you're a resident and you're doing your third year thesis or whatever, or you want to present this in a journal club, and you have an opposing article, please put the link below, because this is about a dialogue, this is about education, this is about peer-reviewed data to help you in your quest for menopause management education. So we want to get the truth out and make sure that you have a good foundation, so when you get out in the real world, you're a much better doctor. Okay, thanks for listening.